What's up, guys? Another night on call, so another opportunity for story time. So this time I want to talk about residency, and in particular a story that happened during my internal medicine residency. So for those of you guys that may not be familiar, residency can last a multitude of years, and it is a chaotic time, it is a crazy time, and you see a lot of interesting things happen during residency, and quite frankly, a lot goes down during residency. But the one thing to keep in mind is that as chaotic as it seems, this is organized chaos. This is the process that every physician goes through throughout the entire world, and this is how you go through training in order to become an independent practicing physician. Now, this particular story happened during my first year of internal medicine residency, so you are literally an infant in your medical career. I was on a rotation called night float, and what that means is that when the day team doctors go home, there's some doctors that stay behind overnight, and their responsibility is to take care of the emergencies as well as take care of the needs of the patients that are already admitted in the hospital until the morning team comes back. So where I trained, the way it worked is that there was two first years that were in charge of night float. So which means two first years split the entire load of the patients. There was about 4 beepers. We each carried 2 beepers each, and we split the floors and we would take care of all of the emergencies. Of course, there was a senior on standby as well, but the first years kind of took care of most of the needs overnight. Now, the colleague that I had with me on night float, me and him had worked together before on a couple of other rotations, and this guy was different. This guy, nothing bothers this guy. It takes a lot to get this guy stressed out and takes a lot to get this guy worried. He was cold as ice. Well, on this particular night, as we're doing our thing, it's a typical night, he's doing his thing, I'm doing my thing. He gives me a call, and I pick up the phone, and I said, hey, what's up? Basically what he tells me is that, hey, are you free for a moment? And I said, yeah. I said, what floor are you on? He told me the floor, and I said, hey, he just didn't sound right to me. Something was off about his voice. Me and him had this bond because we were on some difficult rotations before this, so he didn't have to really say much for me to know something wasn't right. So I asked him, hey, is everything okay? And he basically didn't really give me an answer, kind of just said, yeah. You want to come down for a minute? And I knew something wasn't right. Like I said, this guy, it takes a lot to stress this guy out. So in that moment, I didn't hesitate. I dropped everything I had and took the stairwell and ran straight to the floor that he was on. So I dropped all my paperwork and I headed down. I knew that I was gonna be in for some real when I got there. So basically when I got there, this was the floor. It was 2 floors below where I was, and this was the long-term care unit. Basically these patients are ventilated on mechanical ventilation, very sick, and usually horrible things happen to these patients because of all the complications of being on long-term mechanical ventilation. So I see there's a whole bunch of nurses and a whole bunch of staff crowding outside of a particular room. I run into the room and I see that the patient has a tracheostomy. Now, basically a tracheostomy is a surgical procedure where you have a tube that connects right here to the neck and connects to the windpipe, and that's connected to a ventilator machine. There's multiple indications for a tracheostomy. Sometimes people are very sick and can't be taken off a mechanical ventilator, so they permanently have a tube placed in their neck instead of having the tube in their mouth, because you can have a lot of complications from that. So this was a patient who had a tracheostomy, and at the bedside, I see my colleague standing there. I see 3 or 4 staff, respiratory therapists, a couple of nurses, and a crowd of other nurses that were taking care of other patients standing outside the room. As soon as I go in there, I see that my colleague has his hands up by the patient's neck. They're bagging the patient, giving the patient oxygen, and I notice on the bed, the tracheostomy tube is out. So I see the tube laying on the bed. There's some blood on the blankets. It's quite a messy situation. And what was interesting is that about a month before this, there was another incident that happened again during night float where a patient had a tracheostomy and it fell out. And essentially the staff that night, at the end of the day, everyone does, whatever is best for the patient. Everyone's trying to help the patient. Nobody's doing something that's wrong. So what the staff did that night is they took the tracheostomy and they put it back in and reconnected it to oxygen. What ended up happening is that tracheostomy was fresh. So the same way as when you have a piercing and the track might not be formed, and if you pull out the piercing, the track can close. This was a very fresh tracheostomy. So when the staff overnight quickly put the tracheostomy back in, it didn't follow the same track into the windpipe. So instead, when they were pumping the oxygen and the air was tracking up beneath the skin. This is called subcutaneous emphysema. When this happens, you have a lot of pressure buildup underneath the skin, and your patient can die from that. That's essentially what happened that night. So whenever some kind of adverse and bad events happen like that, we usually have a big meeting with multiple specialties so that we all make sure that mistakes like this don't happen again. In that case, nobody knew that the tracheostomy was so fresh. So everyone tried to do what was best for the patient. Unfortunately, it didn't work out in that scenario. So that happened fresh about a month ago. So we knew not to try to put the tracheostomy back in blindly. We needed to make sure that this tracheostomy was old and not new. So this is when the craziness went down. My colleague was there holding the opening, and they were trying to oxygenate the patient. Meanwhile, we're trying to figure out, is this new or is this old? One of the nurses who was there was trying to help the patient, so she grabbed the tracheostomy tube and she motioned as if she was going to try to slip it back in. My colleague saw this, and he was at the bedside, and without hesitation, my colleague picked up his hand, smacked the nurse's hand, and basically said, "No." I stood there in shock and awe because I knew exactly what he was going after, but it was hilarious to watch him just quickly, without hesitation. He smacked the nurse's hand, and he was just like, no, don't touch the tracheostomy tube. So we needed to find out if it was chronic. I quickly was able to check it was chronic. Luckily, we were able to bag the patient, put the tube back in, took a couple of films, had the patient evaluated by surgery. Everything was okay, patient was okay, but it was hilarious to see my colleague, who's a first-year resident, mind you, smack the nurse's hand and basically tell her no, and basically tell her off that way. But at the end of the day, the nurse didn't take it personal. As long as the patient was okay, everybody was happy. So basically, what's the moral of this story? In a scenario like this, at the end of the day, we always prioritize the patient first. Nobody has malicious intent, not the nurses, not any of the ancillary staff, not the physicians, not the mid-level providers. Everyone tries to do what's best for the patient. And in times of chaos, sometimes it's hard to rationalize and make the right decision. So you have to be prepared for various scenarios. If you might be going to residency, this might happen to you someday. So just remember, if a tracheostomy tube falls out, don't immediately try. It's instinct to just try to put it back in and help the patient, because the patient can't breathe without it. But remember, if the track is not matured, usually takes like about 2 weeks or so. If it's not matured, don't just slip it back in. And of course, don't ever lay your hands on any of your colleagues. Don't smack your colleagues. But in a scenario like that, the nurse, the doctor, everybody, we're all on the same page. We all know each other. This colleague of mine, we're friends till this day. We have a very good friendship all these years later. It was just a funny story that we always talk about, the time when he smacked the nurse's hand because she grabbed the tracheostomy tube. At the end of the day, we're all working together. Always respect your colleagues, especially the nursing staff, and we'll always try to figure out to do what's best for the patient. So that was another interesting tale from my residency. Hope you enjoyed it. Don't forget to like and subscribe, and until next time.